Hey everyone, my name is Mohammed, and this is Andrew, and welcome to the sixth episode of Bare Bones Physiology, a podcast dedicated to exploring the world of exercise physiology while discussing some of the more recent and interesting papers relating to topics that we'll bring up together over here. Our disclaimer before starting this episode is that whatever we discuss here is based on our own understanding and does not represent the full scope of the papers. Whatever we discuss here is also not associated with our current institution. If you would like to learn more about the papers we discuss here, please check them out in the description section below. Now I'll pass it on to Andrew to introduce today's topic.
Great. Thank you, Mohammed. So today's topic is going to be looking at bilateral versus unilateral leg strengthening as well as testing. And this one is sort of something that I would say is I'm very passionate about, because it sort of comes from my background with regard to strength and conditioning and being a strength and conditioning coach, first and foremost. So from the gym that I came from and the philosophy that I've sort of grown up with regard to strength training, I've always been a big sort of fan of unilateral training, not to disregard bilateral training, but specifically unilateral leg training, especially for athletic populations. So before we sort of get into the papers that we discussed today, I just want to break down sort of reasons why people would be doing bilateral training, especially now and certainly in previous generations, as well as maybe why unilateral training has gained in some popularity, especially recently. So when we look at bilateral leg training, well, it's been done for decades. Decades before us, I mean, the literature is littered with bilateral training, back squats, front squats, barbell deadlifts, trap bar deadlifts, you name it. It's been predominantly bilateral training, especially within gym settings as well as team settings. I like to look at different strength and conditioning facilities, and a lot of it's bilateral equipment, even free weights, but also machines. You just see a lot of bilateral work. So the big reason why you would do bilateral training is, well, because it's been done for that long. Another reason why you would also do bilateral training is it's easier to coach in team settings. And what I mean by that is, in a strength and conditioning setting, it's usually one coach per so many athletes. So the gym that I would have came from and gyms that I've worked in previously, it's usually one coach per 5 or 6 athletes. So with that, we can only watch so many athletes at once, right? So whenever we do unilateral training, whether it's plyometric based, whether it's strength based, we really have to have all eyes on the athletes, or else, we risk injuries, because there's so many complications and things that can go wrong unilaterally, especially training wise, compared to bilateral training. Along with sort of leg training as well, when we talk bilateral work, especially upper body, things like bench press, dumbbell pressing, all that sort of stuff done at the same time, you could have other athletes sort of coach and spot each other as well. Once we get to unilateral stuff, it's more hands-on, because you want to make sure that the knee, especially lower body, the knee's not caving in, stressing some of the tendons and ligaments. So another proponent is certainly it's easier to coach. The next one is it provides a significant potential to progressively overload with some of these athletes. So once you get to the top tier of athletes, their external loads are so much that any sort of increment in weight is huge. So the ability to progressively overload these athletes is huge, especially absolute loads. That being a back squat, you're talking hundreds of pounds. Compared to unilateral training, it's really not that much, right? Like 1 pound every couple of weeks on one leg is great. 1 pound every couple of weeks on a back squat, you would presume not so great. That's looking at absolute weight with regard to that. And then lastly, and I tried to come up with 4 points. I could come up with more points for each, but I wanted to keep it fair and go 4 points for each. And this is strictly on my experience and my sort of thought process with regard to both bilateral and unilateral. But the last one for bilateral being stronger and powerful when looking at absolute values, and sort of touching on the previous point, the third point. When we talk absolute loads, it's total weight lifted, total external load. So a back squat, hundreds of pounds. Deadlift, hundreds of pounds. Like absolute loads for some of these athletes looks a lot more impressive bilaterally than it would unilaterally, because you're looking at the amount of external loading. So that's sort of the big proponents of bilateral training, why you would want to do bilateral training. I'm going to touch on the unilateral training. And again, I might be a little biased towards this section, and certainly I went into a little bit more depth, but I never exclude bilateral training. It's not something that I've thrown at the door with athletes that I've worked with. I just considered it more of maybe an accessory movement as opposed to sort of my predominant primary movement, like unilateral training would. So the first point being, certainly it has gained in popularity, especially recently and in athletic settings. And as I mentioned before, my thought process is unilateral being the primary, bilateral being the accessory. For the longest time, it's been switch. It's always been bilateral is the primary, and then unilateral is accessory. And especially when you read a lot of these sort of, I don't want to say reviews on sort of exercise science or strength training, but when you look at some of these thick textbooks that talk about exercise related movements, the first portion is all bilateral. It stresses bilateral. And then there's a few pages at the very end that's just unilateral, just sort of thrown out the door, right? So I think sort of the gaining in popularity is certainly more coaches around the world showing off unilateral strength and showing that you can do so much unilaterally that is very impressive, especially with athletes. So why do I consider, or most coaches consider, or newer coaches, I would say, consider unilateral training beneficial? Well, it allows for less external loading on the athlete, thus potentially not stressing the athlete as much in training. So all the while sort of providing the athlete with equal relative loads. And to provide an example, if you had someone doing a single leg squat with an external load of 100 pounds, that is relative per one leg. It's 100 pounds on one leg. But if you had an athlete squatting 200 pounds bilaterally, relative load per leg is still 100 pounds, right? So you have one athlete who's moving 100 pounds on one leg, where you have another athlete moving 200 pounds, but 100 pounds on each leg, if you were to look at it from that standpoint. So mathematics standpoint, when you look at relative load per one leg, a lot of unilateral training is very equal. And in some cases, you can have a really strong athlete unilaterally that actually has higher values compared to sort of just predominantly bilateral going to per leg. So I think with regard to external loading, that's sort of the biggest one. And along those lines, it sort of allows for, as I mentioned, the less external loading on the athlete. And especially with regard to back squats, and I don't want to get too much down this avenue because there are a lot of strength and conditioning coaches that when I say this is like divided right down the middle, you're either on this side or this side, is back squatting bad? I'm on the fence sort of down the middle. I don't want to be biased towards one side or the other, but reducing the external loading on athletes and the stress that they experience in training is huge. Like I can't stress that it's huge. Like you want to maximize their potential in the weight room while minimizing the injury incidence and the potential for injury in the weight room. So when we talk the bilateral squat, the risk versus reward in some settings, it's just not worth it. So it's thrown out the door. So that's a big thing and a big proponent why unilateral training is so beneficial. Another reason why potentially unilateral training is better than bilateral training is it allows us and allows sort of coaches to develop athlete stabilizers and fixator muscles, especially within the hip. So if we can have an athlete more stable on one leg and preventing unwanted movement on one leg, there's a lot of crossover and carryover to sports because predominantly sports are one-legged. You don't see somebody running with both legs moving at the same time. It's one leg in flexion, the other one in extension, right? So they're doing opposing actions. So that is unilateral. Sports in a sense are unilateral. Off the top of my head, there's only one sport that I can think is bilateral, and that's rowing, right? So it's just a power stroke movement where it's both arms are pulling back and you're extending your lower legs as you stroke. So that's off the top of my head, rowing is the only one. So with that said, most sports are unilateral. Just saying. And then the last point here, and this is sort of the most important point that I want to talk about, is minimizing muscle imbalances. So whenever we do anything unilaterally, we're sort of working on some of those imbalances that some athletes may have, and we're trying to create whole body stability and symmetry. And I think that has the biggest carryover to sports. If we have an athlete that has limbs that perform equal to each other, I think we're looking at a more well-rounded athlete that we could potentially see reduce injury incidence. And that's huge in my opinion, because again, when we have an athlete, we don't want them to be the best weightlifter. We want them to move weight well, but we want them to be the best athlete. It's great to have someone who loves the weight room, but their job is not to be, living in the weight room and moving as much weight as possible. Their job is to perform in their sport, right? And sort of the accessory to that is weightlifting to allow them to do that. So there's certainly opposing viewpoints, and I appreciate both viewpoints in strength and conditioning. And again, I might be on the side of the unilateral side because that's sort of what I've worked with, and I've seen great progress and adaptations with my athletes in the past. But I'm not against bilateral training at all. I have a very open-minded view with regard to this, and I love hearing strength and conditioning coaches talk about both views and their view of why they do it and their athlete successes. I think it's a good conversation to have in the field, and I think with a division between these two sides, I don't think that's a healthy sort of component within this field. I think you want to have two viewpoints, but two viewpoints that are open to hearing each other. So that's just sort of the brief talk about the practical reasons with regard to why you might suggest bilateral or unilateral training. So with that said, we're going to keep this episode a little bit shorter today, but go into depth on some of the papers that we're going to look about and talk about today. So the first one that I'm going to be looking at is the title is a comparison of bilateral versus unilateral bias strength and power training interventions on measures of physical performance in elite youth soccer players. So one thing that I love that this sort of paper talked about is they talked about what a soccer player does in a single match play based on previous data that sort of recorded and measured this. So on average per match, a soccer player covers 10 to 11 kilometers. So that's quite a large distance for some of these athletes. As well, they can jump up to 15 times, and this is just soccer. I think when we get to basketball and some of these other football, for example, the number of jumps performed per game significantly higher, but in soccer it's 15 times. And the biggest one here being change of direction happens 1,200 to 1,400 times in a single match. I thought that number was quite high, but when you think about it, I mean, every second they're moving their bodies, they're changing directions, they're going to the ball, they're playing back in the field. Like there's a lot of change of direction that happens. And the change of direction is something that I want you guys to sort of hang on to, especially as we get to the end of this study. So the aims of the author that they wanted to assess two aims. The primary aim being whether bilateral and unilateral strength and power training improves measures of physical performance in male youth soccer players. So that's just looking at both on their own and seeing what happens. And then the secondary aim was comparing the two to see which one was better, which one was more beneficial for the soccer players, which I think is important as well, because you want to look at them on their own, but you also want to compare them as well to get a little bit more clarity in the field. So they had a lot of measures within the study. It's a good and a bad thing, but I'll sort of go through them. So the measures they wanted to look at was counter movement jump, single leg counter movement jump, drop jump, single leg drop jump, broad jumps, single leg broad jumps, speed at 10, speed at 30 meters, a 505 change of direction agility test, pretty standard in if you watch football, for example, within combine testing, a 505 agility test. And then they wanted to assess strength at being a 1 rep max in bilateral back squat and rear foot elevated split squat. So certainly a lot of measures. One good thing that I like about this is they use bilateral predominant stuff as well as single leg predominant stuff. So it's not favoring one group or the other. Whatever is done for one group, it's done on the other group, just either bilaterally or unilaterally. So I thought that was a good way of approaching this, although there was quite a few measures that I'm not the biggest fan of in this case. So important to note here is they did their pre-intervention testing. And then after the pre-intervention testing, they then randomized the subjects into either the unilateral or the bilateral group for 6 weeks. And this was done in the team's preseason preparation phase of training. But I think it's important to note that it was the randomization was done, after the pre-intervention. It wasn't done before, it was done after, which is important to note. And I'll sort of later get into that as well. So when we look at the exercises that were performed throughout the 6 weeks, we'll just talk the bilateral group. It was just four, but it was back squats, drop jump, counter movement jump, and broad jumps. So four exercises, bilateral exercises. The unilateral group performed the same exercises just on one leg. So it was the rear foot elevated split squat, single leg drop jump, single leg counter movement jump, and a single leg broad jump. And that was done both on left and right legs. Okay, so similar exercises, which again, I really like. That's a strength to the study. Where we get a little bit cloudy is the results of the study. And I sort of mentioned before that there's a lot of outcomes and a lot of things that they wanted to look at. And I thought that maybe was a detriment to this group. But before getting into that, we'll just talk the results real briefly. It didn't really show anything, in my opinion. It didn't show anything conclusive. They had lots to compare the two groups. But really, like, the groups that performed the bilateral exercises performed really well on the bilateral testing. The group that did the unilateral exercises performed really well on the unilateral tests, right? So it doesn't really tell us anything really with regard to the results. But one thing that I did want to mention is, because these groups were randomized after the sort of pre-intervention testing, I thought the authors missed a pretty good opportunity to really match these groups. And for one example here, with regard to the rear foot elevated split squat, okay, the bilateral group's post-intervention rear foot elevated split squat after 6 weeks average was the same as the unilateral group's starting rear foot elevated split squat pre-intervention number, right? So I think that the authors maybe missed a critical window here where you can match these groups as best as you can with regard to the outcomes that you want to look at before beginning the 6 weeks trial. Now, with regard to the statistics, they looked at percent change from baseline, which again, I think is an important measure. You don't want to look at absolute values with regard to the study because they're not matched before the beginning of the study. But when you look at the percent change, I think we both know, coming from an exercise science background, that 6 weeks is not that long to really sort of see significant changes with regard to physiology. Sure, you might see some neural adaptations, but you're not really getting sort of implanted adaptations that will make a significant difference. So I think the downfall of this group is maybe 6 weeks wasn't long enough. Maybe if it was a little bit longer, that would have been nicer to see, because that percent change would have been maybe a little bit more significant. It would have been a little bit more, there would have been a little bit more clarity with regard to the results. So there's some cloudiness regard to that as well. I appreciate the authors also mentioning that as limitation, like 6 weeks may not have been long enough to really see any significant changes and be able to compare between the two groups, because again, they weren't matched pre-intervention. I think that's a big part of this study. However, with regard to one test, and I really want to focus on this one test because it was referenced in the introduction, and that was the change of direction that is seen in soccer, for example, which being 1,200 to 1,400 times per match. The unilateral group actually performed better than the bilateral group on the 505 change of direction test, and the effect size was quite large with that as well. It wasn't a small change. It was a pretty glaring change between the two groups, that being performed going to the right as well as to the left. So it shows some significance that maybe unilateral strength training and power training has some relevance to your agility, and in a sport like soccer, we see that that's really important. How that carries over to performance within the sport. Time-wise, you could be quicker to the ball. How that impacts the score of the game or the outcome of the game is sort of up to the athletes themselves and their sort of will and determination within the game. But performance-wise, you can see that maybe change of direction improves slightly, but a cool study in theory. I really appreciate the authors for going out of their way to test so many different things, but maybe it was too much. Maybe the stats weren't done great. The randomization, in my opinion, wasn't great. And maybe 6 weeks was too short of a window to really see anything significant. It would have been nice to see something longer. But again, with this study, it's using athletes within their soccer preseason. So you can only go up until their preseason and the start of their season. So they were limited with regard to time there. But nonetheless, a pretty cool study and something to maybe build on, especially the agility component. So yeah.
Indeed, I think that okay, just thinking about it, there are definitely very interesting topics that I think we still need to try and explore and understand more about when it comes to unilateral versus bilateral. I think as you said, Andrew, like previous studies, previous guides, they really focus on bilateral, and I don't think that unilateral exercises have been given sort of the focus and maybe even um okay, a little bit of the opportunity for people to try and understand the benefits
Mm-hmm.
of it potentially in certain contexts. But I think that what we're doing today by looking at the literature that exists on this and trying to really shed light on how unilateral exercises and training could be beneficial is something that I think could hopefully try and open some people's minds about that. And I think that just transitioning on from this onto the next paper that we're talking about today, which is in particular in relation to now moving on from training to testing. All right. So now we're going to be looking at perhaps some of the potential differences that might exist between different types of testing. So single leg versus bilateral or okay, using both feet.
Mm-hmm.
And the title of this next paper was written in a very dramatic way, and therefore I'm going to be doing a dramatic reading of the title. So the title of it is Drop Jump, Single Leg Squat, not if you aim to predict anterior cruciate ligament injury from real-time clinical assessment. A
I love it.
prospective cohort study involving 880 elite female athletes.
I love it.
Okay, how did I do, Andrew? I'm not sure if
That
that
was
was.
really good. That was really good. You really teased it
Hey,
well.
yeah, right. Yeah, exactly, exactly. Well, yeah. So basically, as you might have noticed in the title, really the whole goal of this is to try and compare uh single leg squats versus vertical drop jumps. And really the thing that we're trying to compare them on is in particular when it comes to how these tests could be used as a predictor for whether or not an athlete will be likely to get an ACL injury. And I just want to kind of bring everyone's attention to the fact that this study in particular took place over a period of 7 years. And it was a prospective study, and they had 880 elite female athletes that were a part of this study. And when looking at it, I think that this really like sort of almost identifies to us the importance and perhaps the power of this study when it comes to really trying to understand, well, does it actually work, and does one work better than the other? So I think that we also need to first of all understand what an ACL injury is, and I'm sure that many of you have heard of ACL injuries, like especially those that watch sports on a regular basis. ACL injuries are quite common. But why are they considered to be so dangerous? And why are they considered to be something that's really serious when an athlete does have an ACL injury potential? Well, the ACL is a type of ligament that sort of connects the femur bone with the shin bone. So the femur here, or the tibia rather. So the femur here being the thigh bone, as it's casually called, the tibia being the shin bone, as it's casually called. And considering that, I mean, think about it, right? That's literally what connects. That's literally what creates your knee in the first place. I mean, yes, there's a patella. Yes, there are other components and compartments to it. But really, if the two bones are not connected, then are you really able to sort of, undergo many of these movements, engage in physical activity and sports, et cetera, et cetera? Not really. And really, the thing that makes it even more serious is the fact that this ligament cannot heal on its own. So some people, for example, if let's say the tear is not that bad, they might rely on certain non-surgical interventions. But then again, these non-surgical interventions, the only thing that they do is that they almost redistribute how you're utilizing your muscles and sort of the strength of each muscle and maybe the pressure that that's going to be placing on the ACL as a ligament. But it's really not doing anything to heal the ACL. So the only thing that could heal the ACL is a surgical intervention. So considering how serious it is and considering how important the ACL is, it is important then for us, and with an athletic context, to be able to predict, well, is that athlete more likely to have an ACL injury if they engage in sports further? And considering that, like, if they are actually likely to have an ACL injury, then what can we do right now to prevent that from happening? And that, I think, is a really important goal, because as the authors of the paper say, I mean, we have all these types of medical predictive tests, okay, imaging techniques, all these things that are there that could allow us to predict whether or not a disease could occur, or perhaps even detect that disease early on. But with sports types of testing, that's not really a thing that's really concrete. And even when that is the case, the percentages are quite grim. The reliability, the accuracy of these tests it's not very high. So that's why I think that, again, this really highlights the importance of this study. And the different tests that they had were two types. So they had single leg squats, and the way that these single leg squats would be done is that, for example, what would be done is that on one leg, okay, the athlete would sort of try and do, so imagine how a squat would occur. So the squat's going down, sort of bending the knee type thing. So what would happen is that the athlete would try doing that on only one leg, going into the frontal plane. And the goal is to make sure that the leg that is performing the squat goes down to a 90-degree angle. And that 90-degree angle would be confirmed using something called a goniometer. Goniometer is something that's typically used in, sort of exercise testing, biomechanics, that kind of thing. But really what it is that it's just like something that detects the angle at which the person goes down to. So that's what a single leg squat is. And of course, what would happen is that they had either physical therapists or physiotherapists, and sports physical therapists, or just athletic therapists, as they're commonly called here, at least in Canada. And kind of looking at it from sort of many different aspects. But one of the things that they do is that they score them on a scale of 0 to 2. So then the other type of testing that they did was a vertical drop jump. And a vertical drop jump would be that they'd be standing on a 30-centimeter platform. They jump from that platform down to the ground, and then they try and jump as high as they possibly can after that second jump. And the goal there was to make sure that they place like a handball sort of at the ceiling, and that they'd ask the athletes to try as hard as they can to get to that handball that sort of hung from that ceiling. So that was what happened. And again, what would occur is that the physiotherapist or athletic therapist would be there to score them on a scale of 0 to 2, kind of assessing, the method that they used in terms of jumping, whether or not they tried to engage all these different muscle groups, right? The angle that they fell at, et cetera, et cetera, et cetera. And lo and behold, what happened is that when they tried kind of looking at it over all these years, over all these participants, there's actually absolutely no difference. And yes, the numbers might have been a little bit different in terms of percentages, but when we look at like significant difference, there wasn't any significant difference between the predictive ability of a vertical drop jump test versus a single leg squat when it comes to predicting whether or not an athlete is likely to get an ACL injury. And I think that, again, just speaks to the point that the authors brought up in the introduction section, which is the fact that really we have a huge issue when it comes to the exercise tests that exist right now and their ability to predict whether or not an athlete is likely to get an injury. So, yeah, I think that this really drives us into our discussion topic for today. So, I mean, within the scope of what you talked about, Andrew, you talked about unilateral versus bilateral, and the training mechanisms and how that could work out in different ways. And what I talked about is single leg squats versus, of course, vertical drop jumps, which is something that engages both feet or both legs. And then my question to you is, well, do you think that there are any other exercise tests, let's say, that can produce, when we compare, for example, in a single leg squats, which is something that is a strength test, and for example, a bilateral test that would be like a depth drop test. Do you think that there are any other exercise tests that could perhaps be more predictive when it comes to, let's say, non-contact injuries?
Yeah, I guess when we talk about your study specifically and sort of the two that we're looking at, a single leg strength, as you mentioned, and then a bilateral plyometric exercise, you could say as well. I think they maybe missed the window because they could have also looked at a unilateral plyometric exercise. And the reason I say that is, as I mentioned before, when you look at sports, they're unilateral in nature, right? And when we look at an ACL injury, it's labeled a non-contact injury, and it has to do with an aggressive cut that maybe the knee goes into valgus, right? So it's almost like it's unilateral in nature. We see it on TV. It's non-contact, happens unilaterally. So why aren't we assessing it unilaterally? And it never happens very slowly. It's always whether it's an aggressive cut or it's an aggressive sprint or something along that nature where, it's power related. And I think when we consider from that standpoint, we want to look at maybe unilateral force absorption. So I think the bilateral, going from an elevated surface to a drop down level, I think that's a great way to look at it. But maybe unilaterally, how well are they able to control their hip, their knee, their ankle, keep sort of their lower limb alignment correct, not let the knee go into valgus, as well as looking at sort of the absorption behind it as well. Can they sort of handle the absorption nature of their jump and their body weight, their mass, on both legs? Because again, that sort of addresses any symmetries that may be lacking, right? So if we can address some of those asymmetries, that's huge for these athletes, because the whole point of unilateral exercise and any sort of strength and conditioning training for that matter is trying to minimize injury incidents. And as you mentioned with ACL, it's, it happens too often in sport, any sport. It happens too often, and the recovery, the time frame is so long, and it essentially takes a year off someone's career. Not only that, it takes another year just to get back into playing shape. So it is such a significant injury, and I appreciate them when you talked about sort of the study subjects. How many people was it? 800 plus people?
Yeah, it was 880 athletes. I mean,
So
880 over a period of 7 years. That's a really long time and
that
a
gives
lot
us a
of
guard.
participants.
Yeah, that gives us a good sort of overview of
Yeah,
nature. It's not just 10 or 15 or 20. That's over 800 people to look at. And I think certainly we need to come up with maybe better, more clear, concise tests for some of these athletes. But with regard to sports, and I think that's why a lot of people like sports, it's unpredictable in nature. We can't predict anything with sports. What happens from one second to the next second, or from game to game, from year to year, is going to be completely different. It's unpredictable. We just have to do our best as strength and conditioning coaches, and then certainly sort of rehabilitation professionals. They have to do their best to sort of predict the future in sort of a setting that you can't predict the future. And I think that's sort of the mismatch with regard to it. But it was a cool study nonetheless. I think it sort of maybe eliminates and maybe highlights some areas that we should look at. As I mentioned before, unilateral plyometric base, being able to absorb force. That's maybe a direction that they could look at. And I think that's a cool
sure.
direction to go in. But yeah, nonetheless, very cool study.
For sure, for sure. And I think again, you really bring up a great point, which is just the unpredictability of sports.
Mhm.
With an imaging technique, let's say like an X-ray or MRI or whatever, it's right there, right? You have a very concrete sort of scientific approach to like
Mhm.
finding out whether or not someone has something. But with this, it's more so like within a very unpredictable environment. So really, I think that it just places more stress and more pressure on trying to really refine the approaches to testing, refine the approaches to exercise and training that are present within the field of exercise physiology. So I think that that is really what we need to kind of try, and maybe that could be the priority for future literature and future research.
Yeah, absolutely. And I think the barrier with it, and sort of something that needs to overcome, is the fact that, these people assessing these jumps, they're looking at it from their perspective, and maybe, okay, so we're looking at performance and being able to sort of land correctly. But again, the unpredictability aspect of sport is just so much outside of a testing facility that it brings in so many more complications. But hopefully we can sort of narrow the gap and maybe identify something that's a little bit more clear and a little bit more concise. So yeah.
Absolutely. Yeah.
So yeah, with that, like I mentioned before, one article each, we wanted to go into a little bit more depth. So it was a very a shorter episode of bare bones physiology today, but nonetheless very impactful and knowledgeable as well. So thank you all for listening and viewing, and take care. See
Take care.
ya.
Thank you, everyone.